Hi guys, and welcome to this Past Nurse tutorial. Today we are going to run through some basic anatomy and show you how blood flows through the heart. The heart is a muscular pump and functionally is often divided into two sides. The right side of the heart pumps deoxygenated blood to the lungs, where it can be oxygenated. The left side of the heart pumps that oxygenated blood around the body. Blood is transported to the body by the arterial system, before being returned to the heart by the venous system, and the cycle starts again. So, let's run through how that happens. Firstly, blood needs to enter the heart. Blood is carried into the heart via two large veins, the superior and inferior vena cava. The superior vena cava, often abbreviated to SVC, carries blood from the head and upper body, whilst the inferior vena cava, or IVC, carries blood from below the level of the heart. The blood entering the heart via these two large veins is deoxygenated. As can be seen from the image here, both of these veins open into the right atrium. The right atrium is the first of the four heart chambers that blood will travel through. Once the right atrium is full of blood, the muscular walls of the atrium will contract and squeeze blood into the next chamber of the heart, the right ventricle. For this to happen, the blood is squeezed through a valve that connects the atrium and ventricle called an atrioventricular valve, or AV valve. On the right side of the heart, this AV valve is also known as the tricuspid valve, as it has three flaps or leaves, which can be seen here. Once the ventricle is full of blood, the blood closes the tricuspid valve, preventing blood from flowing backwards into the atrium. When the right ventricle contracts, blood leaves the heart through the pulmonary valve into the pulmonary artery and flows to the lungs. The pulmonary valve is also known as the pulmonic valve and is one of the two semilunar valves found in the heart, the other being the aortic valve, which we will come to shortly. Blood is oxygenated in the lungs before being transported back to the heart via the pulmonary veins, which can be seen here opening into the left atrium. When the left atrium contracts, blood flows from the left atrium into the left ventricle through the mitral valve. The mitral valve is one of the two atrioventricular valves along with the tricuspid valve. When the ventricle is full, the mitral valve is forced closed by the blood within the ventricle, which prevents blood from flowing backwards into the atrium. When the left ventricle contracts, blood leaves the heart through the aortic valve into the aorta, and from there is distributed to the rest of the body. And that is how blood flows through the heart. Thanks for watching, and don't forget to head over to pastnurse.com.